Kangen Water is here to help both children and adults alike. I'm having great results with it in my practice, and my patients are loving it. Periodontal disease affects 75% of the population. And periodontal disease is a silent disease of the mouth. In other words, you don't really know you have it until it's too late. What I've found is that we do comprehensive cleanings on people to try to get their mouth healthy again. But we use as an adjunct the acidic water that we make here at the office with our Kangen machine, and we use it under the sulcus of all the teeth, in other words, around the teeth and the gums, to clean all the bacteria during our procedures. And we also send the patient home with the water. When I found out that the Kangen water machine makes 7 types of water, I started exploring the high end, the 11.5, and the 2.5 end of that water. And on my exploration found out that the 2.5 water is bactericidal, and I am using it in my practice to help with bleeding. I use it to sanitize the mouth before I start working on the patients. I have used it in periodontal disease, and I've actually seen reversals of people's periodontal conditions. The teeth will actually tighten up with the use of the 2.5 water.
I've had the great fortune in my life to have graduated from one of the finest medical schools in the world, Harvard. I was trained in the Harvard residency program. I've spent my entire professional career affiliated with that institution. One of the best things, next to being affiliated with this great institution, has been my discovery of Kangen water. The Japanese have done a tremendous amount of work on using ionized water for wound care. There's a lot published in the Japanese literature and also now in American literature about using pH 2.5 water for bactericidal purposes. Staph aureus, for example, cannot survive in 2.5 pH water. The kill ratios are dramatic for this, and so it stands to reason that this would be beneficial for contaminated wounds or even infected wounds. The Japanese, for example, treat diabetic ulcers with ionized water with a low pH and find that to be extremely successful. They also have published a lot on it, and the before and after pictures are very dramatic. The pH 2.5 water has tremendous antibacterial properties against both gram-negative and gram-positive organisms.
The benefit for me as a physician to use water to treat bacterial infections is phenomenal. Number one, water's cheap. Secondly, it's very effective. We've seen through studies, and I've seen through my own observations with patients, that it's very effective. And thirdly, there's no side effects to it. For those of you who are trying to optimize your health and trying to do everything you can to have good health, to maintain your health, preserve your health, my plea is just to try the water. There's nothing more simple, there's nothing more inexpensive, and there's nothing more powerful and effective than Kangen water.